Hello, I'm Dylan Valencia reporting to you from Tulsa, Oklahoma. COVID-19 is no stranger to Americans across the U.S. It affects children, elderly, and adults alike. And over a year after it started, we are still seeing its lasting effects, especially when it comes to mental health. Issues with mental health are continuously rising in the U.S. More recently, these issues have skyrocketed in the wake of the COVID-19 pandemic. We spoke to psychology major Paige Wagner to get her thoughts on the topic.
I think that it's been especially last March when it all started, it was very stressful because everybody was afraid about everything. It was just a very unsure time.
The COVID-19 pandemic has disrupted critical mental health services in 93% of countries worldwide, while the demand for mental health is increasing, according to a new WHO survey. According to the CDC, 1 in 4 young adults have struggled with suicidal thoughts since the coronavirus hit.
It was very stressful because of how new and different it was, but I think now we've kind of grown accustomed to the masks and the stickers on the floors that say, stay 6 feet apart. So it's a normal, so I feel at least for me, the stress has gone down just because it's expected now.
Federal surveys show that 40% of Americans are now grappling with at least one mental health or drug-related problem. But young adults have been hit harder than any other age group, with 75% struggling since the start of COVID. One Tulsa mother, Laura Camargo, has had enough.
She's very extroverted, so she hasn't had a chance to socialize as much and see her friends, and they've been doing virtual school all year, and it's been hard on them, it's been hard on me.
We interviewed her and her family to see how they have personally been affected by COVID-19.
Definitely get your vaccine. I got mine. He started the process on his, and for me that was a huge, I think, lifting a psychological burden I didn't even know I had when I got that. But also support each other and be there for each other too.
When asked how to prevent issues with mental health in the midst of a pandemic, all had a similar answer.
This sucks, and that's a fact.
We can only hope that this pandemic comes to an end sooner than later, and we could see a better tomorrow for Americans all across the U.S., especially when it comes to mental health and counseling. I'm Dylan Valencia. This is DVN News. Back to you in the studio.